A national health interview survey conducted by the CDC revealed that almost a quarter of American adults said they had chronic pain. At St. Luke's Hospital of Kansas City, the pain management clinic creates individualized treatment plans with the goal of decreasing pain, increasing mobility, and reducing or eliminating dependency on pain medication. Joining us today is Dr. Tyler Kincannon, an interventional pain physician at St. Luke's Pain Management Clinic. Dr. Kincannon, we appreciate you joining us during Pain Awareness Month.
Thank you very much for having me.
And Dr. Kincannon, we continue to see a high prevalence of dependence on medications to address chronic pain. What's your team's approach to this trend?
Yeah, so at St. Luke's Pain Management, we try to provide an individualized approach that's very patient-centered. And in doing so, we get to know the patients on a personal level and find what's important to them and helping them restore that function to their lives.
And I want to start getting into specific conditions like back pain. We know it's extremely common, and you and the team at the Pain Management Clinic have various treatment options, and I want to know what some of those are.
Sure. So as you said, there's a lot of things that can cause you to have low back pain or back pain anywhere in the spine. It's our job to kind of figure out where that's coming from and what's causing it. As far as options we have for treating that outside of opioid medications, we're looking at a wide variety of interventions, procedures. And so in doing so, we can start with a simple injection, or we can go into more invasive options. And that can be for people who have had surgery or have not had surgery.
And I want you to kind of specify, is there a difference between someone who's had surgery, hasn't had surgery, and they're still experiencing back pain regardless of that?
Yeah, absolutely. So let's say somebody has had surgery, and they've had surgery to correct the pathology, but they're still having residual pain, such as radiculopathy or pain down the legs, or they're just having a lot of back pain, which just stays in the back, or axial low back pain. One of the options we have there would be a spinal cord stimulator, where we thread 2 electrodes into the epidural space, which stimulates the spinal cord to help distract the brain from the pain signal and doesn't interpret that pain signal.
Dr. Kincannon, another diagnosis in this area is painful diabetic neuropathy. Can you explain what that means and what treatment options are available for it?
Sure. So when someone is diagnosed with diabetes, one of the long-term sequelae of that disease is peripheral neuropathy. And that's when the nerves stop working the way they're supposed to. And so a lot of people will feel this as a burning or painful sensation in their hands or feet. With that, they will oftentimes start shuffling their feet, losing their balance, things like that. One of the options we have to help restore this function after they've exhausted the medications and things like that is a spinal cord stimulator at a high frequency. The studies have shown that not only will this alleviate some of the painful diabetic neuropathy and the pain in their feet, it will often help restore function so that they can start to walk and exercise and lower their blood glucose a lot faster.
Shifting to other areas in the pain management clinic, Dr. Kincannon, you've mentioned interventional procedures. What are those that are available for patients?
So a couple I'd want to highlight. One would be for a patient who has not had back surgery and they have atrophy of the multifidus muscle. The multifidus muscle is a stabilizing muscle for the low back. When that muscle atrophies, these patients will start to develop an axial low back pain that doesn't really have a definitive cause elsewhere in the spine. One of the options we have there is a peripheral nerve stimulator that we insert that will help regenerate that muscle over time. It may take 6 to 12 months, but in doing so, it should alleviate their low back pain. Another one I'd like to highlight is a kyphoplasty, and that's for patients who are typically older in age and have osteoporosis, which is when your bone density has gotten lower to the point that your bones aren't as strong as they should be. When these patients have a fall or lift something heavy, they will get something called a compression fracture, in which the vertebral body or the bone in the spine kind of collapses in on itself. If we can get you into the clinic and evaluate you soon enough, we can go in and do that procedure, the kyphoplasty, in which we minimally invasively access that vertebral body, and then we inflate a balloon or use a spine jack to restore the height that was lost from that initial injury, and then we put cement in that bone to help stabilize it so that that fracture doesn't get worse or occur again.
We've talked a lot about back pain, but I also want to highlight folks who are experiencing knee pain. Can you explain what kind of procedures and interventions are available for that?
Yeah, I'm really glad you brought that point up because we treat a wide variety of pain, not just back pain. So we'll stick on the knee pain, and somebody who's had, let's say, a total knee arthroplasty or a knee replacement, they're still having a lot of pain. So they've got this new knee and they can't use it the way they want to. Yeah. So we have options including nerve ablations as well as peripheral nerve stimulators to help override that pain signal that allows them to use their new knee and get back to the activities they want to do.
Dr. Kincannon, we've covered a lot, but I want to ask you what your final thoughts are as we recognize Pain Awareness Month.
So you made a good point that there are so many people dealing with chronic pain. And with that, we should point out it doesn't discriminate against age, socioeconomic status, anything like that. Everybody can have pain. At St. Luke's Pain Management, we want to bring you in, get to know you on a personal level, and help find you a plan that we can incorporate with you to help you get back to doing the things you enjoy and that provide you joy in life.
Dr. Kincannon, thank you so much for joining us and for all the good work you're doing. We appreciate it.
Thanks again for having me.
St. Luke's Pain Management features a multidisciplinary team at multiple locations in the Kansas City metro. To learn more, head to stlukeskc.org/pain. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks for watching. We'll see you next time on Health News You Can Use.